Hi, this is Dr. Jeff Cole, one of the fellowship-trained hand surgeons at OrthoSouth. Whether you or your family's problem is pediatric, sports, arthritis, fracture or other trauma, nerve or tendon issues, or overuse, hand surgeons are equipped to treat all hand and upper extremity ailments, ranging from the most simple conditions to catastrophic injuries. We use a team approach with our hand therapists to ensure rapid and optimal recovery. Today I would like to talk about carpal tunnel syndrome and break it down to a few pretty simple concepts. The word carpal indicates the bones at the level of the wrist. Tunnel, as you would imagine, refers to a space or a passage. This space is an oval with the floor being a U shape of bones. The roof is formed by a thick ligament called the transverse carpal ligament. For a point of reference, this ligament is almost the exact size of a standard postage stamp. Contents of the carpal tunnel include 9 tendons headed to the fingers and the thumb, and 1 nerve, called the median nerve. In general, swelling in the tissue around each tendon can take room away from the nerve. So who gets it? The concept that you have to key a lot or do repetitive factory work is certainly flawed. Work activities can play a role or exacerbate the symptoms, but almost anyone can get carpal tunnel syndrome. This includes housewives, farmers, or professional golfers, just to name a few random examples. In females, hormonal changes during pregnancy and menopause can definitely play a role. So what are the symptoms? Numbness and tingling in the thumb, index, middle, and ring fingers is classic. Some people feel numbness in the whole hand, but if they stop to check feeling in the small finger, they would likely agree that this feels normal. Pain that can be touched with the fingertip is not classic for carpal tunnel syndrome. Pain at the shoulder, the elbow, or the forearm are also not classic. Numbness or tingling that seems to radiate from the neck or the shoulder usually have another explanation. Waking up at night having to shake your hands to get them to awaken is classic. Other common times to notice symptoms are while driving, doing hair or makeup, or any other activity where the hands are held bent down or bent back for a prolonged period of time. In addition to swelling within the carpal tunnel, holding the wrist in maximal flexion or extension decreases the volume or space available for the nerve by 25%. This is where night splinting plays a role. In addition to splinting, anti-inflammatory medications and injection of cortisone within the carpal tunnel can help to improve or resolve symptoms, and in some cases avoid surgery. Nerve testing is frequently ordered to confirm the diagnosis and to essentially measure the severity. This can also be called electrodiagnostic testing or EMG nerve conduction testing. In many cases, symptoms will recur or persist after initial conservative efforts have failed. In that case, surgery will be offered. My observation is that a patient with classic symptoms, a positive response to a carpal tunnel injection, and an abnormal nerve test will do very well with surgery. If those 3 factors are not in place, I'm very hesitant to recommend a surgery and try hard to find an alternate diagnosis or explanation for the symptoms. We've created a separate video for endoscopic carpal tunnel surgery. Please check it out.